Hi everyone. So this week we'll be talking about page 857 to, I believe it is 863 is where we're going to end up, or 864. Just some housekeeping. So for week 3, we'll want to complete the week 3 forum as well as the week 3 assignment before Sunday at midnight. Any questions, always feel free to email me. So we're continuing on in Chapter 30, starting at page 857 under Drug Names. So you might be wondering, how do drugs get their names? Some of them are pretty complicated. Some of them sound pretty straightforward. And there are a couple different names assigned to drugs. So a drug can have up to 3 names. It can have a chemical name, and that's the name assigned to the drug that comes from its formula. This would sound like something you learned from chemistry class in high school. It'll have a lot of C's, possibly some H's, some O's, and N's. Also, a drug could have a generic name. This is the drug's official name that is assigned by the United States Adopted Names Council. This is usually a longer name that might not make much sense when you say it. It contains the same ingredients as a trade drug when a drug is generic, but is usually much less expensive. So a drug usually has a patent for about, I think it's 20 years from the time the drug was first designed. And it has a certain number of years to be brand only or trade name only, and they can sell it for the top price that they're asking for it. And then once it goes off patent, other companies who make generic drugs are able to pick that brand name drug up and make it as a generic drug and sell it for much less. An example of this would be atorvastatin, which is a cholesterol drug, used to be Lipitor brand only, and within the past decade it came off patent. So the brand name or the trade name is the proprietary name of the drug. It's the exclusive name of a drug substance or drug product owned by a company under trademark law. And here you see it listed as trade. The book has it listed as brand. You'll hear it referred to either or. Use whatever you'd like. If you notice somewhere where I've taken off points for trade or brand, just let me know and I'll X that out and make it equal, just because really it is referred to as both. So that's the 3 different types of names a drug can have. Ooh. So in the real world, right, we have prescribing, dispensing, and administering. These are the 3 tasks that go along with medications. Prescribing means to order a medication from the pharmacy, usually by a prescription. Physicians and mid-level practitioners are usually licensed to prescribe, dispense, and administer. However, mid-levels such as nurse practitioners and physician's assistants are usually under a physician's license. Medical assistants cannot prescribe or order medications, but may be able to dispense or administer certain types of medications depending on the state laws and regulations. Pharmacists are allowed to dispense. We are not allowed to prescribe, nor do we normally administer medications unless it's in the form of a vaccine. That's a relatively new rule, and that came about within the past decade as well. So as you can see here, dispensing is personally handing the patient a medication to take later, and administering is to prepare and personally give the patient a medication through any method at the point of care. So again, physicians and mid-level practitioners, and this depends on the state for mid-levels, can prescribe, dispense, and administer. Mid-levels include PAs and nurse practitioners. Medical assistants, again, cannot order medications or prescribe them, but may be able to dispense or administer certain medications depending on state laws. So, there's lots of regulations and legal things surrounding medication. So the U.S. Food and Drug Administration establishes standards for pharmaceutical companies to follow in the development and sale of prescribed and OTC medications. So drugs, before they can be marketed, must gain FDA approval, and only then can they be sold to consumers. Supplemental mineral products and herbal supplements are not required to go through the same rigorous testing or have data to back up their use. So keep that in mind when you hear someone who says that they're on an herbal medication. They're on a medication that is not FDA approved and that is not backed by data. Controlled substances. These are medications that are habit forming or possibly have a high potential for abuse. There are usually a lot more rules and regulations surrounding controlled substances than there are regular medications. Controlled substances defines drugs or substances that have potential for illegal use or abuse. They're divided in 5 schedules according to addictive property and degree of abuse, which C1 would be the most addictive, with C5 being the least. So these are usually drugs such as sleeping medications, pain medications like oxycodone, sometimes ADHD medications, sometimes medications that might help with erectile dysfunction or low testosterone. There's a whole bunch of different medications that can be controlled, but keep in mind, not every medication out there is a controlled substance. Keep that in mind for your project. So when we store controlled substances, they're usually labeled by a C, as you can see on the bottle here, and they're kept separate from other drugs, usually stored in a secure cabinet or drawer. Large amounts of Schedule II drugs are stored in really, really heavy-duty counters that have locks or are attached to an electronic monitoring system. And there's a lot of record keeping required around controlled substances. So the DEA requires that a full inventory of all controlled substances be completed every 2 years. In addition, a minimum of monthly inventory should be performed with additional inventories every shift in which staff has access, and you should have a witness for that. And any time that controlled substances are received, dispensed, or administered, we document that in a special log. We keep those records for at least 2 years. So disposal of controlled and non-controlled drugs. Drugs not used or never used past their expiration dates. So when we've reached those expiration dates, medication should be removed from a drug inventory and discarded. For non-controlled substances, you can simply discard them in the trash. And for controlled substances, you do have to fill out special forms. So there's DEA forms, just Drug Enforcement Administration forms that you have to fill out in order to dispose of controlled substances. That would be a DEA, let me just make sure I have the right one here. A DEA 41 allows you to destroy controlled substances, whereas the other number you'll see listed is a DEA 224, and physicians must complete and submit that form in order to have a DEA number. Okay, so 224 gets you DEA registration. DEA Form 41 allows you to destroy controlled substances. Ooh, I went backwards a little here. So disposal of controlled and non-controlled drugs. We remove drugs removed from their original containers prior to disposal. Solids are placed in sealable plastic bags with a little water to assist in dissolving. Bags are sealed and discarded in the regular trash and should not be flushed down a drain or toilet. Some offices even have a biohazardous trash or take to pharmaceutical take-back locations. Usually this is run by the police officers. Before destroying controlled substances, here's that form we talked about, DEA Form 41. And those disposal records are kept for a minimum of 2 years. So prescriptions are written legal documents, right? These are not just any forms. They're very important, and most of them aren't even written anymore. Now we keep them on computerized physician order entry programs. All prescriptions must be signed by the physician, including e-prescriptions. And these prescriptions have the drug name, and it has instructions for compounding, dispensing, and administering. So this prescriptions need to be complete in entirety before they can be accepted by a pharmacy. So as you can see here, different parts of a prescription: name, patient's address, the date on which the prescription was written, the drug name and strength, as well as how it comes, the number of tablets, and the directions. So here you see generic substitution allowed. That means they're allowed to use the generic if there is one. If they weren't, they would put here dispense as written, meaning you can only dispense the brand, refills, and label, direction to the pharmacist to label the medication appropriately, signed by the doctor. Also on here is the doctor's office and location, as well as a telephone number. Yep. Okay. So the role of the medical assistant will vary according to state law and office policy. Oftentimes, they can write prescriptions under the direction of the physician, and they can call those prescriptions into pharmacies under the direction of the physician for medications that are non-scheduled or listed in Schedules 3 through 5. And again, this is state-specific. New York is pretty archaic and doesn't allow most of these, so keep that in mind. They may also be able to fax prescriptions to the pharmacy under the direction of a physician. Last but not least, they can create prescriptions in an EHR under an electronic health record under direction of physician, and they provide patients with instructions on how to properly take their medications and what side effects to look for. So, last but not least, prescription abbreviations. These are helpful because prescription abbreviations have a lot of writing. However, sometimes there are prescription abbreviations we shouldn't be using. So use of standard medical abbreviations is greatly discouraged when performing clinical documentation. Be familiar with the Joint Commission's Do Not Use list. And again, this is in Appendix A that provides a list of common abbreviations still used in many medical organizations. So the reason we don't use certain abbreviations is to keep patients safe. These were being confused sometimes, so something that looked like a U might end up being like a G, and that could unfortunately harm the patient if the drug was prescribed and dispensed in the wrong way. Last but not least, tamper-resistant prescription pads. Federal law requires prescriptions for controlled substances, Schedule 1 and 2, written on special tamper-resistant prescription pads and signed in ink on the day issued. Although this has changed in New York State, you can now send all prescriptions by computerized physician order entry over the magical internet waves, and patients are no longer given a hard copy prescription. So, while federal law exists, state laws, if they are stricter, should be honored. And in this case, New York state law is pretty darn strict. So, let's go to Appendix A real quick and talk about some medical abbreviations that stick out to me that we use a lot. One would be HX, or history, possibly SOB, shortness of breath. So review Appendix A. These are abbreviations that are commonly used and that you should be familiar with. I'm not sure. So Appendix B is ISMP's list of error-prone abbreviations. These are ones you want to avoid at all costs. So I would also be familiar with Appendix B. Those are really helpful for deciphering prescriptions when they're written by doctors, because a lot of it is abbreviations. Again, any questions this week, please feel free to contact me by email. And otherwise, good luck, and I'll see you in the forums.